Hi, my name's Kate, and this is what I've learned on my workplace experience. I think I've improved on a few things since my last practice, one of these being therapeutic relationships. Many times in my placement, I would sit and chat to the people I looked after. I listened to their stories and tried to brighten their day. I also made sure to let the nurses know that I appreciate and encourage their teachings. I was able to create some pretty good relationships with my patients by establishing my relationship and introducing myself, sustaining the relationship by constantly checking in and asking if they need anything, and concluding the relationship by wishing them good luck and taking a moment to say goodbye. I believe I worked pretty well under pressure. At one point, one of our patients was a bit frantic, complaining of pain in her abdomen and was getting hot flashes. My nurse told me to quickly grab the ops machine and to take her blood pressure, which I hadn't done before. I reassured my patient as well as explaining everything I was doing, as she hadn't ever taken her blood sugars before. I feel I was able to work very well independently and made sure to always ask the nurse for help when I needed it, such as helping assist patients to have a shower and to administer their medication. Sometimes I would have to work against my values, one of these being the patient's autonomy. One time we were looking after a woman living with dementia and we needed to help clean her, but she was fighting us and saying no. It was really hard for me to help hold her down while she was trying to fight us and get away. Another value I found being challenged was excellence. It's always hard to do everything perfectly when you're on such a busy schedule. Patience was also a value that I found pretty hard to stick by. It sometimes became a bit overwhelming on the ward, with a strict time schedule and lots of patients needing different things, medications to do. It was a bit hard to keep calm and professional for the whole shift. A few things I can improve on for my next placement would be to always check up on a patient roughly 30 minutes after giving them their pain medication. This is just to make sure it's effective and isn't causing them any issues. Another would probably be handover. I get a bit nervous talking to the nurses, but with a bit more practice I should be okay. I also need to pay a bit more attention to detail and not get so distracted sometimes and make silly mistakes. But other than that, I feel like I'm a little bit closer to becoming a pretty good nurse. So thank you for that.